Vax-A-Million ends, still millions of Ohioans lack vaccines. Joining us on Columbus on the Record this week, Laura Bischoff, State House reporter for the USA Today Ohio Network, Herb Asher, OSU political scientist, and Mark Weaver, Republican strategist. When the governor announced the Vax-A-Million lottery back in May, 37% of Ohio's population was fully vaccinated against COVID. Now, at the end of the lottery, 44% of the state is fully vaccinated. After an initial spike in vaccinations, the Vax-A-Million lottery fever waned and vaccination rates fell. And in many Ohio counties, less than a third of their populations have gotten the shot, something that has led to case spikes in other states.
And so we have counties in Ohio that are very under-vaccinated. So yes, I am concerned about those counties in the state of Ohio that have a very low vaccination rate. What we're seeing in other states and what we read from the experts is that those areas, those pockets, are very vulnerable.
Laura Bischoff, so what's the verdict here after the 5 weeks of $1 million giveaways, the excitement leading up to the Vax-A-Million? Was it effective? What are state officials and health officials saying?
Well, the DeWine administration contends that it was a good program. Right after the May 12th announcement of Vax-A-Million, there was like a 43% increase in vaccination appointments. Again, that tapered off. As you said, like the excitement over the program waned. But they also, unmeasured is how much extra attention and awareness was applied to the need for vaccinations. So that's an intangible side benefit. It does seem that, they're going to have to keep kind of juicing the system to get people interested in getting these vaccinations. And it's interesting because in other countries, they're begging for these vaccinations, and in America, you have to be plied with sweepstakes and free donuts in order to get it.
Yeah, Mark, I mean, the lottery brought a lot of attention to it, created some excitement, certainly initially, but it also took away from the message that these vaccines help save lives, help keep you out of the hospital, and help prevent the spread of the virus. Did the lottery take away from that main message, and in the long run, does it hurt the effort to get folks vaccinated?
No, I think the lottery was inventive. It was innovative. It actually spawned many competitors and other governors trying to do the same thing. So I think it was a great idea. One thing we have to remember when we look at these numbers about who's vaccinated and who's not is that we have to add to the vaccinated those people who had COVID and knew about it, and those people who had COVID and never knew about it. The science is pretty clear. If you've had COVID, you're about as immune as you would be if you had a vaccine. So all of these numbers help us get to herd immunity. The governor's right to be continuing to encourage vaccines in all corners of the state. Some folks are just not going to do it, not necessarily because of COVID, because some folks just don't believe in vaccines or don't want to get maybe an untested or an untried vaccine. The good news is herd immunity is still rising for the factors I mentioned.
Herb Asher, the group that is sort of lagging in the vaccination acceptance, aside from the philosophical reasons, is younger folks between the ages of 12 and 39. The governor pointed out this week in his briefing. I mean, those are young folks, so COVID's not going to affect them as bad as older folks. And let's face it, younger folks think they're invulnerable. What is the proper tactic to get those folks to get the shot?
Well, we've been trying all along to educate younger folks because, in fact, they're not invulnerable, and they, in fact, can get serious cases. I think the more significant group are just simply people who live in rural areas, whether it really is here in Ohio or states in the South that have substantial rural populations. And at some point, I mean, there's really a lot at risk here. When you're talking about the Delta variant possibly taking hold in the American population, it'll take hold in those areas where the vaccination rates are very low. So what do you do about this? And what you really need to have here is the message repeated over and over and over again. not just by the governor, who I think is doing a fine job on this, but in fact by local officials and local church leaders and local business people throughout the counties of Ohio, but throughout the regions of the country, saying it's not over yet. Please listen to me and let them take the lead in terms of if they haven't been vaccinated, do so. But look, every percentage or 2 or 5% that you can increase that, you can get closer to herd immunity, but we're still far away from herd immunity. And so I get very nervous, Mike, that some variants could take hold in parts of the country where the vaccination rates are very low. And I think everybody has to join in issuing the message, get vaccinated. You're doing it for yourself, for your community, for your family, and the nation.
Laura, it seems like we're entering where the flu vaccine is every year. I mean, people always say, get the flu shot, prevent the spread of the flu. And, some get it, some don't. But it comes down to basically talking to your doctor. And that's what the governor is suggesting now, that, family physicians and healthcare providers who have direct contact with folks in the rural areas especially, try to convince their patients to do that. Is that going to be effective, does he feel?
I got to say, a couple friends of mine are doctors, and they say that they've been having these conversations with their patients almost nonstop. I think that, Mark said that a lot of people, maybe they're not getting the vaccination because it's unproven, or that they don't believe in vaccines. But I think there's another segment of people who it's still a little bit of a hassle to go take time off work, probably plan on having the next day feeling yucky if it's a J&J, or the next day after the second Moderna or Pfizer shot. Getting a ride there. I mean, it's way easier to get a vaccine now than it was, back when the demand was so high and the supply was so low. But, there are people who are, working multiple jobs, and they haven't had time to get it done. That's one excuse. And I agree with Herb in terms of herd immunity. Yes, there are people who have had coronavirus and they have some immunity. The vaccines are, the advice is that even if you've had COVID, you should still get vaccinated. And, at what we're at, like 50, we're about 50% of our state population has been vaccinated. And I think that we have to get to, 80 to 90% in order to have that herd immunity.
Mark Weaver, one way to get folks vaccinated is to mandate it. Whether it's done company by company, school district by school district, or a government mandate. But the legislature seems to be going the other way and trying to outlaw mandates. What is the role that mandates should play, especially like for like a hospital where, their professionals are dealing with vulnerable people? Should there be some kind of mandates somewhere in this system?
Well, probably not. If you had asked Americans 2 years ago whether their employer could require that employee to talk about a personal health issue and disclose that information, most would say that they wouldn't be comfortable being required to do that. And if you'd asked them whether the government could make them to do that, upwards of 80% of people would oppose that. But now people are saying perhaps there ought to be mandated things that we can't mandate people to take a shot. Of course, you'd have to hold them down. We're not going to do that, hopefully. You can't arrest them, although I read a story this week that one of the countries out there in the world is arresting people who are not vaccinated. We're not going to do that. You certainly can't withhold government privileges or benefits from people who don't do it. Now, whether the private sector does it or not, you've got to give private sector room to do that. So I think we're better off encouraging than we are mandating. And I think you're more likely to get buy-in by convincing than you are by forcing.
Herb Asher, you used to work in your former life with administrators at Ohio State. Other schools around the country have mandated their students and faculty get vaccines before they return to class this fall. Is there any way Ohio State could do that, and politically and legally? I mean, they're urging everyone to get the vaccine, but they're not mandating it.
Well, depending upon what the state legislature does, but they could. And look, universities have been mandating certain kinds of vaccines. The meningitis vaccine, things like that. And we certainly in schools require measles vaccines with some exceptions. So the concept of a mandate for public health reasons is not an alien concept. But what's happened in this case is that everything has gotten so politicized, and it really has gotten to a partisan edge here also, which then gets brought to an ideological level. You're fighting my rights and all of that. And there's a legitimate concern about public health. And so I certainly would rather encourage people, as Mark said, than force them. But I also think that responsible leaders need to be saying that this is a choice you must make for the benefit of the broader society and you and your family. And if lots of people are not going to be encourageable, if you will, then I think we have the opportunity to say, well, then if you're not, then maybe you shouldn't be allowed to go on a cruise ship, despite what the governor of Florida says. Or maybe you shouldn't be allowed to be in this class. I mean, this is more serious than a lot of people are acknowledging. Yeah. And there could be a third or fourth surge if we don't get the vaccination rates up higher. Okay. Ideally, leadership will convince more people to do it. The medical profession, as you said, Mike, would be certainly important, but everybody needs to be chiming in here. And there's too many people, and again, it has a partisan edge to it, that's saying, no, this is a matter of individual rights.
All right, one lesson from the pandemic is high-speed internet is a pretty essential service. With many of us working from home for more than a year and many students learning from home, a good internet connection was critical. Still, nearly 1 in 10 Ohioans lack broadband internet connections. Governor Mike DeWine in his budget wants to spend $250 million to expand broadband. The House wants to spend nearly as much. The Senate, though, it zeroed out the broadband funding, and its budget makes it nearly impossible for municipalities to provide broadband to their residents. Laura Bischoff, what's going on here? Why is the Senate on such a different page when it comes to broadband expansion than the House and the governor?
It's really unclear. I think that this is something that Matt Huffman put into the budget bill, and maybe he's not convinced that the public sector is best suited to do this work. I think that given the fact that the budget, they're going into conference committee, they're ironing out all the differences now. I think that this is something that's kind of a moving target at this point in time.
Mark Weaver, the advocates for limiting government's role in this is they argue that government is an unfair competitor to the private sector in expanding broadband. But if the private sector won't go into those, distant rural communities or those neighborhoods in a city that doesn't have a whole lot of money to pay for broadband, isn't that where government should step in?
I don't know that government is the right person to be giving us, or the right entity to be giving us our internet. I've got my phone here. I bought it from a private sector company, and I'm glad I did, because I don't know that the same city or county that doesn't do my trash pickup or my road repair well ought to be my cell phone provider. I think everybody who leads in Ohio wants to see broadband expanded into every corner of the state, but the notion of city or county government doing it requires an investment not just in infrastructure now, but for decades to come. Some future governing body may choose not to invest it, and now here you've gotten your Wi-Fi through your city or your county, your broadband, and now it's not available to you. I think we ought to encourage as best we can the private sector to innovate and expand so we can get broadband in every part of Ohio. But government should not be competing with private sector any more than we would want government to be our cell phone carrier.
Herb Asher, what is the role here of government? I mean, the government, to use Mark's metaphor, government does provide water lines, and they have to upkeep those. Yeah. Is internet different, or is that the same as a utility like electricity?
Let me disagree with Mark, because the broader issue of the digital divide, we've known about that for 25, 30 years. Newt Gingrich was actually one of the first people to actually talk about the digital divide. We've had so many years in which the state legislature and or the private sector could have stepped up, or the private sector could have gone to the state legislature and said, here are some ideas. But in fact, we learned this year that we still have many residents of Ohio who don't have access to adequate connectivity or whatever. So the notion of community stepping up and doing this, I think, is actually quite appropriate, especially in the absence of the private sector doing this. Look, whenever I hear something gets get introduced into the state budget at the last minute with no hearings or whatever, I wonder who slipped an amendment to whom and for what reason. And so then I start looking at it. Was this a private sector amendment done whether by AT&T or anybody else who's trying to protect their business interests? And I'm thinking the best way to protect your business interests is to, in fact, be proactive in providing these kinds of services in a complete and full and affordable fashion.
Mark,
that's not been the case in Ohio.
Yeah, Mark Weaver, could you argue that I know it's communications, it's cell phone, we've thought of it as kind of a luxury or an option at this point, but you can argue that this is much like electricity now, much like your telephone, that it's necessary to do business, to learn in our current society, and there should be some kind of regulation or at least mandate that everyone get electricity, everyone get connected to the internet on a reliable signal.
Yeah, I don't think you'll find many people who want government to run their cell phone coverage. But let me point out that even if we were to permit this, ironically, the communities that are most likely to have their own broadband services are the wealthier suburban communities, not the poor rural townships where we don't currently have any coverage. And so the movement behind this broadband expansion is really from wealthier places, like Hudson, Ohio, for example, is one place that has it. They're the ones that already have the money to do it. Now, there may be some federal money available, but that's a one-time thing. And so some of the places that don't have broadband have trouble with basic infrastructure like roads. They're still dealing with dirt roads and gravel roads in some parts of these townships. So the private sector is the better way. I think we all agree we should have it. We're just disagreeing on the best way to get it.
Laura, real quickly, is the money that the governor proposed, that $250 million, $190 million in the House budget, was that for lower income areas? Was that what that money was going to go, would target it to expand broadband and folks who couldn't afford it on their own?
It was my understanding it was going to be a grant program in which communities could apply for and then carry out their projects. The main thing with getting broadband to underserved areas is, like Mark says, it's in areas where they're still struggling to pave their roads. And a lot of it is because it's what's called the last mile. It is in less densely populated neighborhoods or areas. And so it's less attractive for private interests to spend the money to build the infrastructure out and then only capture fewer subscribers.
Yeah. All right, we have not talked about it much on this show, but Central Ohio is still short a congressman. Steve Stivers quit this spring to run the Ohio Chamber of Commerce. In about a week, voters will start casting early primary ballots to start the process of electing Stivers' replacement. There are lots of Republicans running, 11 of them. Here they are. The bigger names are State Senators Stephanie Kunze and Bob Peterson. State Rep Jeff Luray has Stivers' endorsement, but former coal lobbyist Mike Carey has the endorsement of Donald Trump. On the Democratic side, only two candidates. State Rep Allison Russo of Upper Arlington. She faces retired Army officer Greg Betts. Herb Asher, 11 Republicans. We missed one. One candidate didn't have a website or a picture, so we couldn't find him. Have you ever seen that many in a primary this late in the process, still in the race?
Very rarely, but whenever a congressional seat opens up, that doesn't happen that often. People oftentimes see, why don't I take my chance? I've got nothing to lose. Maybe I can make a name for myself, even if I don't win this primary. But, how do voters make an informed decision in this race? And this, I think, leads to a question you're probably going to ask about Donald Trump's impact. And if Mike Carey has Donald Trump's impact, endorsement, I should say, and he's able to advertise that might get Mike Carey up to the 25, 30, 35% of the vote that he would need to win a contest in which there are 11 people running.
All right, let's ask Mark Weaver that question. Mark Weaver, Mike Carey does have the Donald Trump endorsement. Stephanie Kunze has the Franklin County GOP endorsement, and Steve Stivers has endorsed Representative Luray. So which endorsement means the most, Mark Weaver?
Well, I disagree that these things are unusual. Each time we've had an open congressional seat in the last 20 years in Ohio, there's been crowded primaries. When John Boehner stepped down, there was a crowded primary for his seat. When Rob Portman stepped down, there was a crowded primary for his seat. When Pat Tiberi stepped down, somewhat crowded primary. So when there's an open seat in Congress, people rush to run. And, Stephanie does have that Franklin County party endorsement. That matters. Mike Carey, who has the Donald Trump, that's very important. I don't think most people really care what Steve Stivers recommends to them. They know who he is, but he's not somebody who's necessarily going to carry a lot of weight. But Jeff Luray is a good person and may get a lot of votes based on his credentials. In a crowded primary like this, you might be surprised who makes it through the end. because what you sometimes see is people winning with 22 or 23% of the vote because all the other candidates slice and dice up the remainder of the voters.
Laura Bischoff, usually the candidate from Franklin County, from Columbus, has an advantage. Steve Stivers, had the advantage. He's from the Columbus area just outside. That's not the case, it doesn't seem, in this one. There's a lot of folks on the outskirts, rural parts of the district who are strong candidates here.
Yeah, I think it's a really interesting race because there's so many different angles. Like you said, like Trump giving the endorsement to Mike Carey. I think that that's going to carry some weight. And I think that, Bob Peterson is very well known in Fairfield County and in the rural parts of the district. Coonsey is more well known in the Franklin County area. This is a district that, stretches from Upper Arlington to Vinton County. So it's an incredibly diverse district as well.
Herb Asher, Allison Russo, state rep from Upper Arlington, seems to be the favorite. She's a known vote getter, well known in her part of the district. Do you see her getting upset in this primary?
No.
Well, does she have a chance in the general?
It depends on what the Republicans do to each other and who they wind up with being the nominee. And if they really wind up getting somebody who wins with 22% of the vote and is not one of the more substantial people, maybe she could win. But it's certainly a Republican district and the Republicans will be favored. But part of her fate will be dependent upon what the Republicans offer up as a candidate.
All right, our final topic. The Ohio Supreme Court ruled this week that if teachers are going to carry guns in the classroom, they should be trained on how to use them. 700 hours of training. The court struck down a Southwest Ohio school district policy that said teachers needed only 24 hours of training to have a gun in the classroom. The Madison local schools put the policy in place after a school shooting there wounded 2 students. The Supreme Court ruled state law requires school districts train their armed teachers as they would armed police officers. Mark Weaver, you work with a lot of police groups. They supported more training for teachers. Does this make sense to you, this ruling?
Well, I read it. It was an interesting look at this, topical subject here in Ohio. Three takeaways. Number one, it was really a statutory analysis, which means the General Assembly very quickly can change this simply by passing a law, and it will negate what the Supreme Court did. Number two, there's a big rural versus urban divide on this issue. Rural school districts like this idea of allowing trained teachers, if they choose to carry concealed. Urban districts tend not to. But what I thought was fascinating, the third point was there's going to be a battle for Chief Justice next year between, in the primary, probably Sharon Kennedy and Pat DeWine, each of whom had their own dissent in favor of allowing properly trained teachers to carry. And Jennifer Brunner, of course, is going to run for Chief Justice as well, and she'd be on the other side. So I think we saw a preview of what might be an issue in next year's Chief Justice election.
See, I thought the politics didn't enter into the Supreme Court. Anyway, and also we should say that the parents in this district are the ones who challenged the policy of no training. But Laura
some
Bischoff,
parents did, right?
Yeah, some parents did. Yeah, it wasn't unanimous. But Laura Bischoff, there are laws or bills pending in the legislature that would change or actually quantify how much training teachers would need. Correct?
Right, and as Mark says, the General Assembly can change. They can negate the ruling by just changing the law, and I would expect that would probably happen pretty soon.
Herb Asher, were you ever packing when you were teaching at Ohio State, and is it a good idea?
There were times when I thought I would like to, and then I realized the times I thought I would like to, I shouldn't be carrying.
So what's the solution here, Herbie? Safety is a concern of these folks. Is it just more resource officers, police officers in the schools?
I mean, a whole variety of things. But I think Mark said, look, we want teachers to be trained. We don't want people coming into the classroom who really don't know how to use a gun or don't know how to use a safety lock or whatever. So it's really the question, are there best practices that we could really have that you don't go down a legislative route or start mandating a specific, but just get the notion that there is training. And I think everybody would agree, no, nobody should be going into the classroom without the appropriate training. There'll be disagreements about how much is needed, but I think everybody would say, well, of course teachers should be trained, and teachers shouldn't be, of course, forced to carry if they don't want to. So this becomes such a bit high visibility issue, but there's some common sense that has to be applied here also.
All right, let's get to our off the record final parting shots. And Mark Weaver, you're up first.
Well, along the lines of what we just talked about, when I was a young Republican consultant, I traveled around the country in 1994 advising governor candidates and Senate candidates. And the top issue was crime. Everywhere we went in the country, the top issue was crime. And it helped lead to a Republican sweep that year. We are seeing crime creep up on the polling issues of Americans, Ohioans, even people in Central Ohio. I suspect it will continue to be a top issue and will affect the elections next year.
Okay, Herb Asher, your final thought.
Along those lines, two things very quickly. President Biden understands what Mark just said, and indeed now is trying to put the Democrats behind the mantra of support the police and reform the police. And I think that message needs to be delivered to the Columbus Fraternal Order of Police and to the leaders of Columbus City Council.
Okay, and Laura Bischoff, your final thought.
Two things. One, a shout out and a welcome to my new colleagues, Haley Bemiller and Titus Wu, who are joining our team. And we're looking forward to doing some great journalism with them. And then also I wanted to point everyone's attention to a story that I had today about ECOT and Bill Lager's campaign contributions were subpoenaed by the FBI from the Secretary of State's office back in 2019. So that indicates that there's a, in federal investigation on ECOT, there's the open one on Cliff Rosenberger, and then there's the House Bill 6 one.
Yep, the scandals are there. My prediction, North Carolina instituted their vaccine lottery after Ohio did. They were after us. I predict 100 years from now, they will say first in vaccine lotteries, just like they say they are first in flight, even though we know the Wright brothers are from Dayton. That is Columbus on the Record for this week. Check us out online, Facebook, and also our website, wosu.org/COTR. For our crew and for our panel, I'm Mike Thompson. Have a good week.